In Good Health, brought to you by McLaren Northern Michigan.
300,000 to 400,000 U.S. citizens every year have symptoms from lumbar stenosis. I'm Dr. Joe Weistroffer, an orthopedic spine surgeon at McLaren Northern Michigan. And it's something that is basically part of an aging spine. You know you have it when you start to get back, buttock, and leg pain that gets worse when you walk and gets better when you sit down or you lean forward. And it's something that happens in 1 in 1,000 people over the age of 65 and happens to 1 in 5,000 Americans that are over the age of 50. The reason this is such a big deal is that currently there's 70 million Americans that are over the age of 50, and that number is going to increase by almost 20 million in the next decade. And it's something that can really affect someone's life. Lumbar stenosis is, I liken it to like a choking of your nerve roots. And it's something that as it starts, it's only bothersome. And as it gets worse, you have to figure out when is it bad enough that you think you should do something about. Because there's risk with doing a surgery for it. It does have good results. About 8 or 9 out of 10 people that have the surgery report that their pain is better. But notice I didn't say it was fixed or cured or totally gone away. In some people it does, but it's a pretty good surgery for making what's called neurogenic claudication, making that back, buttock, and leg pain that gets worse when you walk, that gets better when you sit or lean forward. It helps make that get better. So when you've got lumbar stenosis and you got pinching your nerve roots or whatever, it's really not about those things going on. It's really about how is it affecting you or your patients. How bad is it changing how their life is? And if it's a nuisance and it's problematic, but they're still able to enjoy their lives, we don't need to do anything surgically about that. We want to support them as best that we can in ways and try to avoid the surgery. But if their pain should get to be worse, then that becomes an option, but only after we, under careful consideration with the team, primarily with the patient and the family, we decide that's the right way to go. Then that's where we go with it. We're not treating x-rays and fancy doctor terms and disease processes. We're treating people and their lives and how these disease processes affect their lives. And it's a simple weighing of what's the risks of the procedure or the treatment and what's the benefit of the treatment. And really, that balance is best described by the person that's having these problems, and that's the patient. And I think that that's where the main focus should be, is doing the best that we can to help the patient get the best health care that they want and that fits their needs.
For more information or to schedule an appointment, go to mclaren.org/northern or call 800-248-6777.